Welcome back, everybody, to episode number 4, I believe, of Healthcare Trailblazers. We're very happy to have the wonderful Dr. Matt Berger come by today.
Hello.
Dr. Berger is a friend and someone I look to as he has built a successful psychiatric practice, right?
Yes, sir.
They're doing a lot of great things, and thanks so much for stopping by.
Thanks for having me. It's interesting.
Yeah. So, all right. So take us back. So you go to medical school. First of all, why'd you get into healthcare? What made you jump in?
My dad was a doctor.
Okay.
My brother's a doctor. My mom was a rehabilitation specialist, MCS stuff, masters. And it was just, I don't know, it wasn't planned. A lot of what I did was not planned. It was just sort of all organic.
Fair enough.
It just sort of happened. And, I graduated high school in 3 years, didn't know what I wanted to do, went to college, decided to go to medical school, and just
Took the course.
Yeah.
I guess, with all that family background, I guess the question would be, if you hadn't become a doctor,
exactly.
what was going
on? Cops' kids become cops,
right.
Doctors' kids become doctors. Generally, it's what you learn, what you see growing up.
Yeah. So all right. So family, I guess, made you want to do that.
Yeah, I think so.
Positive
I think it was
role model.
Positive role model, and something that, I felt affinity to, and it was just interesting field, and it was just something I felt that I could give back to the community, and also, good job.
That's the goal. So was this out? So where'd you go to college? Where'd you go to med school? Was that out here?
I went to college at Southern Methodist University in Dallas, Texas.
Okay. And
then I went to the Dominican Republic for medical school, because I did college in 2 years. And they have a 6-year program, so it was a combined college medical school rather than. So I saved 2 years. I did high school in 3. I was always in a hurry. So I did high school in 3 and college in 2 and then medical school. And then I came back and did my residency in Delaware.
Okay.
Wilmington.
Nice. And where'd you grow up?
Hyde Park, New York, Poughkeepsie.
Okay.
Small town. Great place to grow up. Ride your bike. Very. Not much crime, felt very safe, just did that sort of, played ball in the streets and went out in the fields and made hay bale forts and shot BB guns and that kind of stuff. It was a pretty idyllic kind of a Mayberry kind of.
That's awesome.
Growing up.
Yeah, I did a couple years in Postville, Iowa myself, which is really out in the middle of nowhere. So, yeah. Definitely great memories from then as well, building snow forts and all that kind of stuff.
And Poughkeepsie, when I grew up, it was pre-IBM, so it was very rural. I mean, it was farm country.
Yeah.
Actually, it's kind of similar to what Wilkesboro, Scranton is today, but 10 years ago.
Interesting.
Yeah.
And now it's almost, there's like a bit of a resurgence going on.
Yeah.
So what drew you out to Pennsylvania?
Again, just sort of happened.
Took a map and
one of my good friends was chief resident where I went to did my residency. He was 2 years ahead of me, and he called me up when I was chief resident and I was starting to look for a job. My wife was pregnant with our first child. She was due in October. I was doing a lot of moonlighting because I had a lot of debt at the time, and as all residents do.
Yeah.
And I was very busy, and he said, there's a job here in Wilkesboro. It's with First Hospital Corporation. You can come up here. They take care of everything. It's a salaried position. This makes a nice salary. I figured I'd come up for a year to get my debt under control, have our first child, and then during that time, I would spend time, during vacations and weekends, holidays, trying to find where I really wanted to live. That was 1989, when I was going to stay a year, maybe 2. And so I came up, and at the time, First Hospital was hiring outpatient doctors to run outpatient clinics as a sort of feeder. They were using the spoke hub idea, right? The hub would be the hospital, and the spokes would be these outpatient clinics. And they brought us all up. They brought 4 of us, actually, 4 doctors at once. And in September, they fired us all because they decided they were violating the RICO statutes.
Okay.
That was the RICO statute said you can't create a situation where the doctors will only go to one hospital, or only inappropriate relationship, that I would only send my patients to their hospital because they own me.
Okay.
Which was kind of true. I mean, that really was the idea, that they would hire these outpatient practices, and the government said that's violating the RICO statute.
So they had to cancel that.
So they had to fire us all. So they fired us all, which put me in a very awkward situation, to be very honest with you, because I knew, except for what Dave, knew nobody up here. They gave me 30 days notice, so I
Wow.
had no money. I was deeply in debt. My wife was about to give birth. And in medicine, all the good jobs are in July 1.
Why is
Because
that?
it's the cycle.
Okay.
Everyone, you graduate, you graduate, you start residency July 1, you graduate residency, everything switches July 1. You become a first to a second year, a third year, all on July 1. So all the good jobs are on July 1 because, you like January of that year, you start looking.
Right.
And then everybody goes July 1, they start their new job. So all the good jobs were gone because it was September, not July. And I didn't really know what to do. I honestly had no idea. And I was really worried because I had no money. We had a lot of debt. I had no job. And I said, you know what? And we didn't want to move because my wife was literally about to give birth. So you can't move. And I would have been moving for kind of not a great job.
Okay.
Leftover.
Yeah.
Whatever Drek was
So
left
you had a
over.
couple options, but nothing great.
I didn't even have options.
Oh, wow.
I was going to have to start looking.
Wow.
Like flying around trying to find jobs. Looking, and back then there were newspapers before the internet. You'd have to go. You'd go to the trade journals, like American Journal of Psychiatry, and look in the back and see what was there. So it was pre-internet. There wasn't any Indeed or Monster. You had to do that. And my wife said, "We just can't move. I just can't move right now." I said, "Well, you can stay out." She's like, "I don't want to give birth by myself while you're working a job in Iowa, or whatever." So I decided to put out a shingle. That's what I did. I sublet space from an endocrinologist, 100 square feet of space.
Wow.
And I had a part-time receptionist who was a cosmetologist by trade. And she literally would unfold a card table and plug a phone in the wall. We had a little metal box. And I sublet his personal office, not even the whole suite, just his little personal office. And the secretary would take his pictures and diplomas down and put up my pictures and diplomas twice a week. Yeah, for twice a week. And it was literally sort of like Lucy, psychiatry, 5 cents. Wow. It was. We didn't know anything about insurance. In fact, for a while we weren't getting paid because I didn't know you had to be paneled. Like I would see the patients and I would submit a bill and they were like, "You're not on our panel." I'm like, "What's a panel?" "You have to be credentialed with us." Like, "Why? I'm a doctor." They're like, "No, it doesn't work that way." So we were seeing patients, and I wasn't even getting paid for the work I was doing at the time initially. So it was quite a daunting experience.
Take like a bit of a step back because I'm imagining you in that position. Everything in your life is like, a little chaotic. You've got a child imminently on the way. Job's gone through. Most people look for a bit of a safety net. Try to find, even if a job is not going to be great, try to go that direction. What possessed you to go in the opposite and find something that's even more, you're extending yourself even more?
Well, I think two things. One, we really couldn't move at that particular time, so I would have had to find a job within a driving radius in this area, which there wasn't a lot of, to be very honest with you. Number two, I've always been extremely optimistic and very can-do. Like, you give me a task and I'll do it. And I've always been like, I can do that. If you're hardworking and smart, you can get it done. And I've always been both relatively smart but very hardworking. So my feeling is I can do this. I mean, why not?
If anyone else could, I could.
Right, why not?
Yeah.
I mean, I'm sure there's going to be challenges, but okay, I can do this. And that's always been my attitude, that, you give me a task, if I set a goal for myself, I'll get it done.
That's awesome. So you start in 100 square. That is tiny. 100 square feet. My personal office.
Right. I'm sure it really was. It was tiny, and literally she would unfold a card table. That was, and I we had paper charts. There was no AMR. It was. So
you started just you and
her.
Yeah.
Part time.
Okay. Wow. And then twice a week you're seeing patients.
Twice a week,
You're
and
not even getting paid half the time.
Half the time wasn't getting
Then you
paid.
fixed that, I'm sure.
Yeah, I got a billing service. I was like, and he said to me, like, "This is you need to do all these things." I'm like, I didn't know that. The one thing I really think that is unfair, at least in medical school and residency when I was getting out, and I don't know if that's changed, and I don't think it really has, they give you no background in any of this stuff. I mean, they teach you really good medicine and how to be a good doctor, but they don't teach you how to be a businessman at all.
Yeah.
No one gave me any insights on how a practice worked or what to look for, or they basically like go forth and run free in the forest and figure it out yourself.
Yeah.
And I think that's wrong.
Yeah, and we see that every day. It's definitely unfortunate. I think some people like yourself who has a business sense and can run a business. So you figure it out. But I guess a lot of doctors who don't even have it in them, I mean, I guess school's prepping them just for a job. They're not prepping them to open anything.
I think they really do. And again, I had no business background. I mean, I never took a business course in college.
Yeah.
I mean, I minored in military history. It didn't really help me very much in running a private practice. You know what I mean? So it was all, feeling your way and just sort of instinctive and having some good people around me who helped me with, understanding. But it was all organic growth. I mean, our second office, which was much bigger, I think it was 1,000 square feet of space.
Okay.
Our file room was also the bathroom. So if you needed a file, you had to sit on the toilet to get to the filing cabinet. And that was our second office. It was huge in comparison.
It was a castle.
Yeah, it really was.
So how long did you stay in 100 square feet?
About 6 months. Six
Okay.
months. We started growing. I was doing a lot of consults at the hospital. I did a lot of running around. You have to really hustle. At that point, I was taking, anybody asked me anything, I went and did it. You need a consult in this hospital, sure. You need to see this patient, sure. That's I think the thing. You just have to be available and willing to do the work, and I was. I made myself extremely available to anybody who needed any work done. I was there.
Yeah, being flexible, and something we've talked about through a number of these episodes is it's a certain level of humility and not taking yourself too serious that allows you to open yourself up to opportunity.
Yeah, I mean, at that point, I was at the low end of the totem pole. I mean, I needed the work, what I mean? And I think that if you do take yourself too seriously, and I don't think the word is pride, because I had pride in my work, but I wasn't arrogant or narcissistic. I mean, I just did the work.
Did what got to be done.
Yeah.
Yeah. So you grow into your next office. You hired on full-time staff at this point.
I hired the cosmetologist. She now became a full-time worker.
Yeah.
And office manager, and everything else. She was our
lots of hats.
Exactly, because she was my only employee.
Yeah.
And then it grew pretty quickly from there. And then my best friend from medical school, who also was 2 years behind me from residency, Dr. DeSoto, he decided his wife actually was from Clark Summit. He didn't even know that I was, and so he joined the practice, and so now we had the two of us in this tiny little office, and
Wow. So let's take a bit of a jump forward to today, and then we kind of go back and walk through how you built to where you are today. So today you're doing dozens of programs and a lot of new treatments. Talk to us a little bit about
I mean, one of the things I've always prided myself is that I always like to say we're cutting edge, even though we're in the middle of nowhere, Pennsylvania, and we do things that actually a lot of university programs don't do. And I think that's important to be able to, I'm not going to say a risk taker, because it's not risk, but to be willing to adopt innovative treatments and therapies. Obviously, they're all FDA approved, and we don't do anything off crazy, not Dr. Frankenstein. But for instance, we have 2 transmedic stimulation chairs, and when TMS came out, it was very new, and now it's more common. But I think there's only 2 in the Wilkes-Barre-Scranton area, 2 offices that have it, and the chair itself was $140,000.
Wow.
Yeah, it's not just a chair; it's device, and that's a big investment.
Yeah.
You don't know. I read the studies, and I did. You have to do your research. There's a lot of good literature on the use of TMS and depression, et cetera. And but I said, we have to do this. If we're going to stay on the front edge of psychiatry and medicine in this field, we have to get one.
Yeah.
So we
now,
got one.
Are you the one in your organization that's still finding and constantly looking? Is that still you, or have you gotten that off your plate?
No, that's definitely still me. Though what I always say is we have once a month we have something called a journal club, and a journal club is basically all the clinicians get together, and we discuss articles that they've read, and sometimes we'll have a topic, post-traumatic stress disorder. In fact, what we did on Friday afternoon was we did long-acting medications for ADHD, stimulant use and non-stimulant use. So we did that. But in that is a forum, because now there are 4 psychiatrists plus myself. We have about 12 or 13 physician's assistants, a fair number of nurse practitioners, a fair number of psychologists, social workers, partridge and pear tree. And that's our opportunity. And what I say to them is, if you bring something to the table, I will absolutely explore it with you. So if somebody comes up with an article on whatever and that we're not doing it, and I'll say, well, we won't immediately adopt it, but we'll explore it. Let's bring it to the table. So we have a very open forum, and I encourage innovation. I always say that if one patient comes in and says to me that, you know, they've been depressed their whole life and nothing's worked, but they get up every morning, put on a clown suit, stand on their head and sing the Star Spangled Banner, and they're all better, at least 3 refractory people will be in clown suits within a week, because let's try it. It might work. So I'm a big believer in being innovative and I'm not going to say aggressive, but I guess aggressive might be assertive when it comes to innovative treatments. So we do transmagnetic stimulation. We do inhaled ketamine. We were doing infused ketamine, but inhaled is easier to administer. We do electroconvulsive therapy. We're looking at setting up the infusion for the Biogen product, which is the chelating agent for Alzheimer's disease that gets rid of the plaques and tangles, the amyloid to some degree. So, you know, we're always looking for the next treatment. And a lot of times these treatments are not cost effective. They're not profitable. And they're not, because they're expensive, and, you know, insurances are sometimes slow to pay for them and patients can't afford them. But it's a value-added service because we pride ourselves that we're going to be the ones who are in the forefront of these treatments, so that when a patient comes to us, even though like inhaled ketamine it's a loser. We lose money every time we do a treatment, to be very honest with you.
So that'll never change?
It will at some point, maybe, but right now we lose money because it's very labor intensive.
Okay.
The patient has to be there for 3 hours. They have to be monitored by a nurse. There's a whole process that it involves. So it's labor intensive. It's just not really cost effective. But there are patients who respond to inhaled ketamine that respond to nothing else.
Wow.
And I'm not willing to withhold a effective treatment to patients because it's not making me money. And we also write off hundreds of thousands of dollars of bad debt every year. You know, people who just can't afford it. Their insurance isn't paying and they can't afford it. We write it off.
Yeah.
I don't think I've ever sent anyone to collections.
Wow. And yet you have a successful practice.
Yeah, and that's the advantage of having a successful practice. I can afford to do that. Yeah. If I was a small mom and pop single doc, I couldn't do any of these things.
Yeah.
And so I always tell people that, yes, it's a healthcare business, with both words just being as important. It's healthcare, but it's also a business. And so when people say to me, well, you're trying to make a profit, yes, but that profit, on one hand, allows me to offer services to people who don't have any money. Like I take medical assistance. A lot of private practices don't take medical assistance. Mm-hmm. I write off a lot of debt every year because I say, listen, this patient can't afford it. You're just going to write it off. I'm not going to nudge them for whatever. And it allows me to spend $140,000 on a TMS chair. So by being profitable on one hand, it allows me to be charitable and innovative on the other.
Yeah. They absolutely go hand in hand, and you're right. Like a lot of people make that mistake where, you know, you vilify the success, and especially when you're talking healthcare, it's like, how could these two values align? How could you be a doctor and, you know, and someone that's looking to heal people and at the same time trying to run a business? And there it is.
By this exact way.
They work hand in
hand. And by making a profit on one hand, I'm able to afford to give away services on the other.
Yeah.
I literally give it away. You know, the TMS, every time we do a TMS, it costs us about $100.
Wow.
Okay,
You're
each treatment.
That's
minus my cost.
Yeah.
And there are patients who their insurance pays $70. I eat the other $30 a lot of the time because I can afford to. Now, there are some insurances that pay better, so that helps offset what I lose there, but that's the healthcare business.
Yeah. Let's talk about culture a little bit. So just off the bat, you've mentioned, did you say monthly meetings with the team?
Well, monthly meeting, we have the Journal Club. We have team meetings more than that, but the Journal Club is once a month.
And is that lively? Do you get that kind of back and forth from your team?
Absolutely.
That's amazing.
Absolutely. People really enjoy Journal Club. Even though we're not an academic institution, it allows people to maintain that academic feel.
Stay relevant.
You know, and stay relevant. And also, you know, you want to be able to talk to your colleagues. And it's also a great forum to talk about a difficult case or go over something that you were worried about. You know what I mean? So it's a good forum.
So how do you cultivate that? How do you create a culture where your staff are not just clocking in, clocking out, a lot of businesses have this issue where the business owner, so to speak, is the one that's got all the drive and all the fire and all the passion, and the employees see themselves just as that. It sounds like you've got something a little bit more interesting.
Yeah, I mean, I think healthcare is a little bit different than the other ones because, unfortunately, the culture here is a little different in the sense that it's a healthcare business. And do I have clinicians who are just, they do a good job, but they want to do their job and go home? Absolutely. Absolutely. It's important to encourage them to become involved. But some people just don't, and you can't force it. But the key is, I think, to find people who have that drive and innovation, and also enfranchise them as a part of the practice.
And how do you do that?
I think by being open. I'm always available. My door is always open, and talking to people about, what can we do better? What are we doing that we're not doing? Allowing the dialogue. We've always said, it's funny, as we've grown, we've now had to become somewhat of a corporate structure. You have to have a corporate structure. We had to bring in a consultant and all that kind of stuff. But I always said we still have to keep the family feel. We are a family. This is your work family. And so it's always one of my goals to create that family sense. I mean, my staff knows they can come to me. One of the billing people was going through a bad divorce. She needed a lawyer. I gave her money. She paid me back at some point. I mean, I've done, different things like that. And we all have family. We also do a lot of events. Like we'll do a big Christmas party or a holiday party. We do barbecues in the parking lot. We've done like crawfish broils. We've done concerts. We always try to keep that, barbecues in the backyard and in the parking lot. We get an ice cream truck to come in, those kind of things to
That's awesome.
enfranchise people. And also, honestly, we do profit sharing. Every year, I mean, we're one of the few companies in the area, I think, that still does profit sharing. And I always say, if the practice does well, y'all are doing well.
Yeah.
So it's not just about me making money or growing the practice. It's all about them growing the practice, because they know that as long as they're growing the practice and the practice making money, they'll make money too.
Yeah. And would you say that's one of the keys behind having staff not just feel like part of that family, but taking that extra mile, looking to work harder?
I think it's both. I mean, I think you have to find the right people.
100%.
Because, again, it's the healthcare business.
Yeah.
So they have to be interested in getting their patients better.
Yeah.
It can't be all about, like, I'll make more money and therefore I'll stay longer. It's got to be, I want my patients to do well. I want my, we really, and I know it's hard to believe, but we really do want every one of our patients to get healthy. Now, we're not going to do that, being
right.
that, it's just not possible. But we want them to, and we really try.
So let's dig in for a sec into the HR piece of this. So what is your process? How do you find those people? Are you involved in the interviews?
Absolutely.
Okay.
But I have a great sub-staff. I mean, my sub-commanders are phenomenal. I have 3 clinical supervisors who are just amazing, super hardworking, tremendous people who I've had with me 20 years, some of them 18, wow. 20 years. Yeah, we have very little turnover. People, they're called lifers. They're going to be here for life.
They're here.
So, yeah, they're here. And so I depend on them. Like, everybody, like if a new person's coming on, they interview them first. They give me a recommendation. I interview them. But yeah, I'm involved in the hiring of all the clinical staff, not of the office staff, not of the secretaries and administrative stuff.
So what do you look for when that new recruit is in the room? What are you looking for?
I think drive, energy, excitement about what they do. Looking to fit into the culture that we have, treating everyone with respect, patients, staff. I'm theoretically the boss, but I do everything. I'm not afraid to get my hands dirty. I always say that I see more patients than everybody else. And it's always going to be that way, I think, because you have to lead by example. If they thought I was just hanging out doing nothing all day or doing administrative work all day, it would take away their drive to see the extra patient. But they know that if a patient calls in distress, I'll squeeze them in somewhere, usually, if I can. If it's a legitimate So they think, well, I can't let him do that.
Right.
You know, and then I won't. I'm sorry, I'm on my break. I can't see you.
Right.
You know what I mean?
Right.
So I think leading by example, and again, it's just a culture. It's a concept. So we look for people who are going to fill in that gap, who is excited about doing their job, who wants to get patients healthy, who have innovative ideas, who are willing to stay a little late or come in a little early.
That's awesome. And not just to create that, but to maintain that through your different stages of growth and through, you know, like you're continuing to hopefully move in that direction. You said, you know, you brought in a corporate structure now. So to be able to maintain that, I think is kind of unique.
Yeah, it's again, it's really about getting good people and trusting their judgment and allowing them to, I'm not a micromanager. I'm here if you need me, but I think I've picked out good people and I'm trading them well. Let them do their job.
Yeah.
Don't hover. And they know that. I'm not a micromanager. And I'm not going to second guess them and yell at them. I mean, listen, we all make mistakes on occasion, but
yeah. All right, so that's kind of where you are today, where you're doing all these exciting things. You've gotten to a point where you can be flexible and you can put, you know, patient care all the way in the forefront because you're running a successful business. So let's go back to those kind of different stages of growth. So you're in your second office. You've got one full-time employee. You managed to get out of your 100 square feet and your plug-in phone. What were the other steps, and how did you kind of steer that forward?
Well, I think it was again, very optimistic.
Okay.
I've always felt like if I build it, I can work it, it'll come. And it really did grow organically. You know, we moved from that small office to another office, and we outgrew that one, and we started hiring employees. We started hiring PAs and nurse practitioners and, you know, growing the practice, and it just sort of grew. And then we decided to move, because we had two offices. We had one in Scranton on Electric Street, and we had one in Kingston, which we moved that office twice also. And one of the things I thought was really unique about this area, and when I first came to the area, there was almost like a prejudice between Scranton and Wilkesboro. And I remember when I said to my people who I was working with, family practice and tournament, I'm going to have an office in Dunmore and I'm having an office in Kingston because I think right now I need to spread, you know, because whatever. They're like, oh, it'll never work. I said, well, what do you mean? He said, because I remember this really clearly. Wilkesboro doctors won't refer to you because you're a Scranton doctor, and Scranton doctors won't refer to you because you're a Wilkesboro doctor. I'm like, what, are you kidding me? They're like, no, it's just the way it is. Wilkesboro and Scranton are very, very separate. And the doctors in Scranton hang with the doctors in Scranton, and the doctors in Wilkesboro hang in the doctors in Wilkesboro. So that was a concern. I was
Is
like,
it still like that today? Have they gotten over that?
I think to some degree, but there is still a little bit of a colloquialism between the two. I mean, when I tell people that I drive to Dunmore or, you know, to Moses Taylor in Scranton pretty much 4 or 5 days a week, they're like, all the way?
Yeah.
I'm like, yeah, it's like 18 minutes by car now, you know. You don't need a passport or anything anymore.
Show your ID down the highway.
Exactly. So that was a little bit of a daunting thing, but it worked out very well. You know. So we had the two offices, and we grew the Kingston office twice. We moved from, I was in right next to the baseball field with Dr. Grossman, the dentist, and then I moved and I bought the building from Pediatrics Associates was there, and I owned half that. I mean, I worked half there, and Pediatrics was there. And then we decided we were going to consolidate into one building. And we thought Montage Mountain, kind of central. And again, we built, it was one of those things when we bought the building, it was way too much building. And everybody said, you're nuts. You're like buying all this building, and now you're going to lose all your clients again.
Yeah.
Because nobody from Wilkesboro is going to drive all the way to Montage to see you. And nobody from Scranton is going to drive all the way to Montage to see you. I said, I think it'll work out. Optimism, hard work and optimism. So we bought the building. It was actually a insurance adjuster's building originally.
Okay.
So we had to retrofit it, and it took a ton of money.
Yeah.
Actually, I'll show you how much broke we were. And we weren't broke at that time, but both my partner and myself, Dr. DeSoto, had to pledge our life insurance.
Wow.
Because the bank wouldn't give us a loan because it was too much. And we said, okay, we'll put our life insurance up if anything happens. Which
kept your life insurance.
And
you've kept it thus far.
I've kept it. Well, Dr. DeSoto unfortunately passed away in an auto accident, blessed memory, and he So we actually did use his life, but the building was, anyway, it had nothing to do with the building. But my point being is risk taking. You have to be willing to take risks. You know, I could have sat quietly in my office, you know, and gotten a job somewhere and been in my first office. But, you know, I started hiring people, and people said, you know, you're hiring too many people. You don't need this big office. We got an EMR when nobody had an EMR in the offices. And I was like, this will be a good thing. And so I think it's optimism with hard work and the ability to take a risk, to see what might this be. You know, maybe if I build this building, I can have space. And now, not only have we filled the building, we've had 2 additions built onto it, and we're looking at building a 3rd addition. I have to get a new parking lot, but that's another issue.
That's awesome.
Yeah, and again, everybody said, you're nuts. You're spending all this money. You're investing. You know, we bought this big building, and we had to retrofit it, and, you know, we didn't fill it. We actually rented some of it out initially. Now we've taken that space over too. But I think being willing, you know, people always say, you know, you're successful. And I always say, these opportunities were there for anybody else.
Yeah.
I mean, you know, if there's a certain amount of envy or, I mean, like, I started with 100 square feet of space and a part-time receptionist.
Yep. Yep.
And through a combination of hard work and risk-taking and being not too stupid, I've built this.
Yeah.
It was there. Anybody else could have built it.
Yeah.
But, you know, when people say, like, well, boy, you built that building and you bought it, I'm like, yeah, I was scared.
Yeah. I think, you know, people like to talk about luck and people get lucky and this and that. And I think what you're saying is the definition of luck. It's a combination of constantly taking every single opportunity, every single time, and maximizing it to the fullest and working hard. And if you do that, you will, so to speak, get lucky.
Right.
Because you took the opportunity, and maybe the first 10 opportunities didn't work out, but that 11th one turned into something, you know, really great.
I 100% agree with that. I think that there is a certain amount of luck involved, but we make our own luck.
That's my point. It comes to you when you.
You know, I was watching a documentary with Kobe Bryant about it, and he said, yeah, I was a talented player, but I also got up at 4 o'clock in the morning and started working out, and I had 3 sessions in the gym every day.
Yep.
And most players only have 2, and I figured I'll do a 3rd one. You know, or you look at, you know, they always say that Larry Bird, you know, he was the last one to leave the garden, and after the games he'd be running laps. Everybody else would be taking showers, and he'd be running laps. So it's a combination of luck, talent, but hard work plays a huge role.
Yeah.
I mean, as I was telling you, I'm doing rounds at 2 hospitals on Sunday today, and I'm the boss.
Yeah, he's still on call. He's
right.
Yeah. That's amazing. That's great. So, what's the vision forward? You've accomplished a ton. You don't seem like someone that's gonna I'm content, kick my feet up. So what's?
Well, we're still growing.
Yeah.
We're hiring more nurse practitioners and PAs. We're trying to hire more psychiatrists. We're looking at doing what's called an MAT, medication-assisted treatment for drug and alcohol, like Subutex and Suboxone, Sublocade, because there's a real need there. And I think there's an opportunity to do it well and provide a service. And again, provide a service and make a little profit, and yet provide a service that people really need. Healthcare business, you know, both being equally important, because again, if you don't make the business work, then the healthcare closes down and nobody gets a service. Yeah. So we're going to look at that, and you know, there's some opportunities with some hospitals going up in the area, and there's still a lot of opportunity in my particular field locally. So
for other doctors out there, where do you find yourself looking to stay on the cutting edge, to stay current, and to find, you know, all the latest info?
I listen to podcasts.
Okay.
There's a couple of good medical podcasts that are excellent. The Carlotta Report's excellent. I read journals still. You know, it's funny too, because with the onset of the internet and the access to literature, 20 years ago, pre-internet, when I would send people to like University of Pennsylvania or, you know, McLean in Boston, those guys had stuff that I just didn't have available to me. Well, now I get it the same time they do. And now when I send them for second opinions, they're like, well, you've already done what we would have done. You know what I mean?
Right.
So yeah, I mean, the internet has been a tremendous advantage for us in the terms of being able to get the latest and greatest information at the same time as it hits the journals and the art. You know, so they're really like, you know, in the old days, being in a university setting really gave you an advantage in terms of the latest innovations that really doesn't exist that much anymore, because we get the articles
everyone gets it.
the same time.
Do you find there's too much info and you got to focus on, like, you got to know where your proper
Yeah,
sources are?
absolutely. You know, you can't read every journal.
Yeah.
There are just too many. You can't read every article. There's just too many. So you have to have certain which are kind of your go-tos that I read pretty much every month.
Yeah. Wow. So continuing to grow forward. Sounds like it's been a tremendous journey. Yeah, you know, some people get things handed to them, and sometimes you can look at that and people could say, you know, well, why not me? But this is a story of just tough work, you know, out in the middle of nowhere.
Right. Nobody handed me anything.
On the way, 100 square feet. That's
100 square feet, no job, no money.
Yeah.
And I was living in a half a double on Vaughan Street.
Wow.
And I remember we couldn't afford air conditioning, and my wife was really upset about that. We could not. I mean, because she's from South Texas, and it was hot in July and August, and she was pregnant, and it was hot, and we couldn't afford air conditioning at the time. We couldn't afford anything at the time, you know, which is always so funny, you know, because people see me as successful, and there is a certain amount of like, but I started with really nothing.
Bottom.
Yeah, at the very bottom of the dam. Broke with a baby on the way, so to speak, you know?
Yeah, yeah. I mean, even broke people today, a lot of times. I think about it, and I feel like everyone, and this may be right or wrong, but I feel like everyone is better off than their parents in this generation. I feel like as humanity, you know, we're moving in the right direction. We're going forward. You know, even people that are impoverished and have a tough time today are doing well.
Well, I always say the definition of poverty in the United States is very different than poverty in the rest of the world.
Yeah.
You know, our poverty class has a problem with obesity. Let's think about that for a minute.
Yeah, those two things.
They have too much food.
Right.
Which, again, it's terrible food. It's mac and cheese, and they're not eating vegetables. And I understand that. It's not quality food, and we would like to improve that. But our poverty class has a problem with obesity.
Yeah.
You know, you go to anywhere else in the world, and the poverty class is starving to death.
Yeah.
You know, go to the South America, go to, you know, Africa, go to Asia. If you're in the poverty class, you're starving to death. We have created such abundance in this country, and God love it, it's the greatest country in the world, that our poverty class has a problem with obesity.
Yeah, and hopefully people in this country continue to be enormously successful, and we shouldn't be vilifying that, because, like you said, success in the right hand, you know, in the right hands, but that's just a personal choice. But success leads to more giving, you know, and when it's done in the right way, it's a beautiful thing.
Think about it. I mean, how many jobs? I mean, my organization has over 80 employees.
Wow.
So I'm employing over 80 people, and these are good
80
jobs.
families.
These are good jobs.
Yeah.
These aren't, you know, subsistence level jobs. These are good jobs with profit sharing and 401k and health care and paid vacation, you know, the full sort of package that we afford, and you know, bonuses. And so as much as my practice is my practice, it's, you know, we have electricians who work on the building, and, you know, the trickle-down effect really does work. I mean, I have more than 80 employees that have good jobs.
Many of those have families, and that's, you know, hundreds of people that are being, you know, supported by this organization that you created. And that's, success is a beautiful thing.
Yeah, it really is. I mean, I never vilify success. I think that, and especially, you know, if it, you know, I'm not a hazard. My dad used to say you can't eat with more than 2 forks. So what do you need?
Right.
You know what I mean? I mean,
it's a good line.
You know, so I give back. I give back to my employees. I want them to participate. We do the profit sharing. We do the bonuses. You know, we give away. Like I said, I think we probably write off over $200,000 in debt every year.
Wow. Well, Dr. Berger, this has been an absolute pleasure. We wish you tremendous continued success. And thanks for coming by.
Thank you very much for having me. It was fun.
Yeah.